Hello and welcome. I will be reviewing some AI tools to enhance medical education. I have tried to keep this talk very practical and just focus on some of the available tools and some of the upcoming tools or research that you can either do yourself or follow along. So let's get into it. So, before I share the tools, I want you to have this framework in mind. We think about the role of AI in these five levels. Level one will be when there is AI has no role at all, and humans are taking on all the burden of collecting the data, interpreting, and making decisions. Level two is where AI system starts creating or following along in a shadow mode, but is not providing any value addition. Is just in a learning mode for the automation. Level three, when the AI assistants start, usually the AI is taking on some simple jobs such as data gathering or data organization or data interpretation, and maybe some suggestions to the human, and human is taking on the decision. Level four is when there is partial automation, that some of the tasks, including decisions, are being done automatically by AI, but some higher level task or where the AI is unsure can be then delegated to human for a final check. And level five is full automation, where AI is doing all the work on their own. There is no human supervision or approval needed for any of the decision making by the AI. All right, let's look at some tools now. So I have divided the available tools into these five areas to consider when thinking about tools that you can use in medical education. The first area is personalized learning. In personalized learning, what we are thinking about is how AI can help adapt the learning to an individual. And that could be an adaptive learning platform where the information being given to the student can change. So not every student have the same information, but the information is presented or adapted to each student individually. And there could be intelligent tutoring where the student interact with the AI to do some tutoring. I'm going to share some examples of it. I mentioned a few names here, but still this is an early area of research. Adaptive learning is a challenging task, but I think on the whole, intelligent tutoring is relatively easier, where you can kind of chat with an intelligent AI system, which can help with your learning and clarify some concepts as you're reviewing the material. So the first example I shared is called Newton Alta. Newton is a adaptive courseware that provides student with an adaptive model of learning. So the content being given to the student and is adjusted based on its complexity, based on the student's level of performance. So there is some feedback from the student, or there's some assessment of the student ongoing. In the old way or model, the way this was done was that you would create a kind of a tree of a learning course, and which branch of the tree the student is taking, and each node is dependent on the student's selection or student's assessment. Now you don't need to create a predefined tree. You can just let the AI take care of the decision of how detailed or how informative information needs to be shared at this point, and then it can do an assessment of the student or ask a simple question from a student to decide if it needs to escalate the amount of information and continue to repeat the information that is still not made sense to the student. So imagine a lecture where the next slide or the does not come up until the last slide concept is clear to the student based on a simple assessment. So very interesting concept. You can probably create it in some of a slide manner. So each slide or is a page that a student reads through, answer a simple question at the end, and if they don't get it right, then some more information is generated on that related to that slide context, and then if the student does get it right, then a new slide or next slide is presented to the student. Another concept is this osmosis that is taking a storm very quickly in all the medical colleges in America. It's some form of a pre-created content, but the platform that delivers is somewhat adaptive. It's very visual heavy content, and the idea is to provide kind of a videos or small animations or brief pieces of content, but then a platform which can adapt to what content should be shared next. And a lot of colleges have started to try osmosis, although the content is still limited. Tutoring, I mentioned earlier, the concept started way back by IBM Watson when IBM Watson was launched. I believe in 2007 or so. There was a lot of enthusiasm around an intelligent assistant that can do various things. It can help with research to researcher. It can help clinicians making clinical diagnosis, and it can also be your tutor or teacher. Many new platforms have come up. Even Watson has evolved into Watson X, and the idea is that it's a dialogue-based tutoring system, has a central server, so it's scalable, and then you kind of interact with it, ask questions, or it asks you question and you answer it, and based on that, so it's called kind of like bedside learning that we do with when we're doing clinical rounds with our students. But imagine having that ability for basic sciences for any subject for that matter. So the second area of tools that I wanted to highlight was this rapidly growing area of virtual patients and clinical simulations. The idea is to either provide an AI-powered virtual patients, and I gave example of body interact and human patients by Kaplan, or some kind of a diagnostic simulation exercises like DXplain. But this is more of an area of research. The idea is that we have used virtual patients or simulations or dummies before, but usually in the past, what you have to do was to write a script for your fake patient. So it could be an actor, it could be a dummy with a voiceover pre-recording. You will write a detailed script. You will write all possible scenarios and answers. So it will take a lot of effort to write like a 30-page script for a simple 15-minute exercise. What AI will do will be that you don't have to have a predefined script. You can just give some parameters and give AI the decision to give the answers based on what question student is asking, and then be creative as long as it stays true to the original scope or clinical scenario that has been given. So there's a lot of room of experiments here. And then diagnostic simulations will be very good. We used to have these books which were like case-based learning books, or we used to have these books which were 5-minute cases or symptom-based cases. So you can create an exercise where a patient comes in with bloody vomiting or bloody cough, and then you don't have to write a script for it, and you can allow students to just interact with the AI to go through what tests they will run, what test the results they're getting. And the good thing about that is that AI will keep changing, so you can go back and practice again, and the AI may give you a different result on EEG or EKG or another testing next time around, because there is no pre-written script, and AI is just being creative at the moment based on the previous interaction with that student. So here's an example. This is Body Interact. These are virtual patients, and the idea is that it allows students to practice in a controlled environment. So yes, if you have access to a lot of patients, then many times you would wonder that why do we need virtual patients, because we have plenty of patients. We can just send to the patients to interact with them. The downside is that it's hard to capture those interactions of the student, so you don't have a visibility what mistakes the student is making or how good the student is performing. The other problem is that you may not have the exact disease or condition that you need, and then it may not be same across the students, so you cannot compare students between each other or the effectiveness of your teaching. So for example, you gave a talk on how to approach a patient with hemoptysis, bloody sputum, and or bloody vomit, and then you ask all the class or group of students to go in and interact with the patients. Now you may not have enough patients, so you may have to then have 3 or 4 students to each patient, or the patients may be very different, so you cannot compare how one group did with the other as accurately. Then it becomes very subjective. Another example is the I-Human Patients by Kaplan. Another good thing about this interactive scenario is that now it's also integrating EMR, so it's almost like you're writing a H&P while you interact with the student, with a patient, and then everything is captured, and you can see if the student was hitting all the EPAs or entrustable professional activities or skills that your milestones or competencies that you were hoping the student will engage. You can watch a brief video on YouTube. You don't have to memorize the link. You can just search for I-Human Patients by Kaplan, and you'll find the videos. So another thing that I have not touched too much in this talk that I did in my previous talks, which was the increasing role of virtual reality and augmented reality. The benefit of VR is that it brings the 2D information into a 3D space, and that allows for more complex information to be understood. For example, understanding anatomy, so especially complex structures, valves, blood vessels, understanding in the heart and in the brain, various pathways is very complex unless you see them. And sometimes they try to do very creative drawings like Netter's anatomy on 2D pages to try to make a 3D view of it, but nothing beats of actually seeing something 3D. And that's why dissections have not gone away, but dissections have their limitations on the how good of a quality of a body or organ is. So I think VR adds a lot of value. And then even superior is AR, which can take real life information like a CAT scan, a chest X-ray, MRI, or any other information, or actual sitting patient, and then you can project the virtual image onto that real space to try to see this thing in context or in clinical context, like on imaging context. So you can teach MRI much better or a CAT scan or chest X-ray much better if you can actually project information onto it through virtual reality. So going on to the third area of medical education, which has AI tools being developed, I couldn't find any clinically commercially available tool. There is a lot of research going on automated grading of the students' efforts. Grading has always been a lot of work for teachers, and it has always, because of the time limitation, the amount of feedback you can give when you're grading an exercise or an assignment has been very limited. Similarly, skills assessment have been very human dependent. You have to arrange all these OSCEs or various examinations where the students have to come in and be observed, and it's very difficult exercise. You can only do it once or twice a year for the whole class. What if AI tools can help with that, either on paper or typing or on video feedback? I'll share some research ideas, but there is no commercially available tool I could share with you or show you. So this is a research I was doing, which idea was that if we have a rubric or a criteria to assess the HNP of students, can that rubric be graded or HNP be graded by the large language models, LLMs like ChatGPT? And we did show that it provide very reliable information in terms of same scores as a faculty would give, a human pro will give to the students, and it does even better job with unfamiliar tasks where there is no rubric that exists in terms of concordance with the scores with the previous performance on familiar tasks. And then the third thing was that's missing in this information here is that there was even more detailed feedback that can be given point by point to the student. Again, the downsides were looked at, such as risk of hallucinations or errors. Hopefully, gradually that will go away, or that can be improved with integration through evidence-based AI that I will be sharing later on in the presentation. I shared a link in the bottom. I don't know if it's still working, but you can see the full detailed presentation at that link for this research I have done. On the flip side, another interesting thing I wanted to share was that there is increasing AI tools that will listen in to a conversation and then just write a note out of it. So typically that has been a skill that was hard to teach and it took a lot of time, where students will come, take a history from the patient, then write a note out of it. And writing a note meaning that you have to do some intelligent construction of the information and asking the right question. Asking the right question still is a skill that you'll have to learn, but putting it together into a more intelligent summarized note could now be given to just AI. I gave one example here, ISA-MD. There is many other examples like Sully.ai and Freed.ai, which can do the same thing. They will just listen in on a conversation, and then they would transcribe that information into literal text, but then take that information from the text to construct a structured clinical note that can be then put into the chart or shared with the other provider. These tools can then also be used to try to score the HNP, student written note. So if they listen into the student, they create a note and student create a note, and they can be compared and see what the student missed when writing a note from their own conversation. And then that conversation can also be graded to see, okay, what questions they forgot to ask or they should have asked to get a better information from the patient. All of that would, so this is basically listening in. So now there is an intelligent audio transcription or AI-based audio transcription already built in, which further enhance what we were trying to do with HNP rubrics of just written submitted notes. Another effort has been to help generate assignments, whether it be questions, whether it be case based learning or patient oriented problem solving, or so on and so forth. I did a research where I created a tool called QuizMD, and we were trying to generate USMLE style multiple choice questions from lectures. So people will upload their PowerPoint or PDF or article or a book chapter, and it will generate questions for them. And there were many factors that go into writing a questions. You can select different settings, and what you would get will be a structured question that may or may not have a clinical stem. You can get the Bloom taxonomy classification, difficulty level of the question, and in the 5 options. A detailed explanation can be generated by that, and then something like this can be linked with evidence-based AIs to get you actual references of the detailed answers or of the question itself. You can then integrate images into it. Currently, I'm not working any more on it, but my plan is to restart it at some point, taking it more towards case-directed learning. But really, MCQ generation is very easy. ChatGPT can do it in a small numbers. If you have to do large numbers, then you need a dedicated tool, because ChatGPT will create 10 questions. Maybe one of them will be usable with some edits, or 2 of them will be usable. It will have a lot of issues and errors that can be removed by a dedicated tool. I heard about another project called Quizzy.ai that are trying to do the same thing. I'm not sure if it's quite commercially available, but you can search on it. But it's another startup, and I'm sure many of the startups will try to integrate this as an option, where you can just generate questions from their content or any other content or just an idea or topic. In this tool, you can even throw in like a clinical case you saw, and it will generate a clinical case question around it, something like that. It's not currently available anymore, this QuizMD specifically. All right, so next area I wanted to highlight is clinical reasoning and decision making. Again, this is still an area of research, mostly not many commercially available tools, but you can, for some limited context, you can use open access like ChatGPT, especially their O1 model, the new model that came out, and so on and so forth, for some of these exercises. And these are basically walking them through reasoning, clinical reasoning and decision making, and showing you how to problem solve, or showing you how to think, or showing you how the AI thinks. Eventually, it may become level 4 or level 5, but you at least need to understand how it's doing the reasoning. One example I'm sharing is the decision support training. And then I have done a lot of these clinical case exercise with ChatGPT, even with 4.0, before O1 came out or O came out, and it was doing really well. So this is one example. This is a very old one. I'm not sure which AI level it was using. I'm not sure if it's still commercially available or not. But something like this could now easily be built on ChatGPT as a simple project. And the idea would be that you will give it a clinical scenario, and it will discuss the clinical scenario with you and walk you through on how you would think for differential diagnosis, what testing you would do, and so on and so forth. And then, of course, you can link it with evidence-based AIs that can link it to the actual research articles. Perplexity can do it, Claude can do it, and there's some dedicated one for medicine that I will show you later on. So last topic is the research and data analysis skills. A lot of students do research. They try to learn at least how to analyze evidence basis of a recommendation or a research article or a journal, how to critically analyze it, how reliable that information is, how good was the study design, and so on and so forth. And then the current existing evidence is becoming really, really huge. Hundreds of thousands of articles have been published and continue to publish. So you need a tool to try to search through them or get an evidence-based answer without having to go through all the articles to read it. Humans have been doing it through UpToDate. UpToDate was this idea of summarizing the evidence in a structured way in a textbook form that is continuously updated. I think every topic is updated every 18 to 24 months. And I'm sure UpToDate at some point will integrate AI tools to do it. But if you don't want in a structured kind of an UpToDate article to read, you just have a question to ask, you can just use tools like OpenEvidence.com. It's not .ai, OpenEvidence.com, to try to get the information. And then if you're writing research papers, then there are tools that can help you. There's data analysis tools that are available. I showed a couple, Jenny.ai, PaperPow, but I'm sure if you search for exact problem that you're having, you will find an AI tool that can help you with it. So this is Jenny.ai. It's an intelligent research assistant. It's an AI-powered workspace that help you summarize information from articles if you're referring to them, keep track of your citations, help you write, improve your writing language, give you suggestions of what things to say when you're summarizing an information, and really makes it quicker and easier to write a research article, a good quality research article. Here is another option, Paper Paul, which is again academic writing, doing similar kind of things that I mentioned earlier. And then I mentioned OpenEvidence. OpenEvidence.com is an AI powered medical information platform. It has basically ingested all the evidence articles and continuously update. And then you can basically just ask a question and it will summarize an answer for you and give references for the articles that it has used to create that information. There are some other resources to research, or Reach RX is another one that I have put the logo at the bottom. But I'm sure there are many others that are trying to do it. But Open Evidence seems to be becoming the most popular to do this. So you don't have to go to PubMed or some other place to try to search an article and read through the articles to get to your answer. The AI will search it for you. So it may at some point replace UpToDate. If it is not already have. So if you need to see what's the latest evidence for treatment of Bell's palsy, you don't need to go to UpToDate to look for it. You can just ask Open Evidence and it will summarize it for you. And they say it will be always free for health providers. All right. So this was a brief summary of some of the available AI tools and some of the ongoing research in areas of interest, tools that you can build, maybe give you some ideas, tools that you can search for. This is not a comprehensive list. There's hundreds, if not thousands of these tools available. And I didn't have enough time to do that a comprehensive search, but I'm sure if you have an idea, a problem that you think an AI can help you with, then you can search for the tool and I'm sure you'll get it. Thank you so much. You can reach out to me at email, find my channel on YouTube, and also connect with me on LinkedIn. Thank you.